Okay. Again, the title, Beyond Aesthetics, Muscle Stimulation for Functional Improvement. And I'd also like to recognize Dr. Duncan for her data for this study. Those are my disclosures. So in terms of background, in terms of musculoskeletal impairments, we know that they can affect all of us. It affects daily activities, our ability to do work, participation in social activities with family and friends. It's characterized by motility limitations, muscle aches and pains. It can be manifested by weakness, atrophy, stiffness, sometimes spasticity, and this can caused by injury, disease, or just getting older. We've already mentioned about HIFIM. The combination of synchronized RF with this can be used as a standalone for a proactive approach for improving muscle strength and preventing injuries. It can also address the issues such as decreased muscle mass, strength, and improving functional abilities. Again, the technology HIFIM, it's non-invasive electromagnetic stimulation. And what's important to note that it activates the heat shock proteins as well as satellite cells and results in muscle hypertrophy and hyperplasia. And this has been documented with multiple histology studies. It also results in muscle strengthening, can reverse muscle atrophy, improve patients' range of motion, and also potentially help reduce injuries with stronger muscles. RF, we know, basically heats tissue. In regards to muscle tissue, it results in vasodilation with increased blood flow. It can improve nutrient oxygen delivery to the muscle fibers, as well as removing waste products such as lactic acid. And we also know that heating adipose tissue can result in apoptosis, such as non-invasive fat removal. So this is a sarcopenia study, and we know that sarcopenia is age-related muscle loss, muscle mass and strength. Deconditioned muscles fail to support correct posture and various bodily functions. This can result in functional decline. Patients can have reduced mobility, reduced independence for seniors, as well as decreasing quality of life measures. So this study was designed with 7 treatments of HIFIM standalone for the pelvic floor, combined with 4 treatments with a combination of HIFIM and RF. The cohort was 30 patients, ages 26 to 75, with BMI of 19 to just over 33. The primary outcome measures were functional, including the evaluation of maximal and comfort gait speed, time to get up and go, balance test, and the number of steps they could do in 2 minutes. The secondary outcome measures were an in-body measure of skeletal muscle mass, as well as using DEXA scans to look at bone mineral density. These are the primary outcome measures. You can see on the left, gait speed, tug test, balance, and number of steps. And you see the 2 columns first in the center, the total cohort of 30 patients. Their comfortable gait speed increased by over 32%, and in seniors over 45%. Maximal gait speed over 25% for the total group and 37.5% for seniors. Time up and go test reduced by 21% for the total group and over 20% for the senior group. Balance improved over 11% for the total group and over 30% for the seniors. And the number of steps they were able to do in 2 minutes increased by over 18% for the total group and 20% for our senior group. This shows the gait speed, and you can see for all the subjects from baseline, 1 month and 3 month, that their comfortable gait speed increased by over 32% and maximum speed over 25%. And for the senior group, over 45% increase in comfortable gait speed, and their maximum increased to over 37%. In terms of the secondary measures, the muscle mass at 3-month measurements, all patients gained 0.9 pounds in muscle, and patients over 60 years of age, it was 1.4 pounds. The bone mineral density test didn't show any significant changes. HIFIM plus the RF didn't have any effect on bone metabolism, and it was felt to be safe to be used in senior patients. So in conclusion, this is a study that shows that HIFIM technology may have some functional benefit for patients and help them actually with day-to-day activities of mobility. Certainly for seniors, it helps them maintain their independence, increase gait speed, decrease time up and go test, better balance, and able to get where they want to go a little bit quicker. Improve musculoskeletal function, as well as improve mobility and everyday activities. Thank you.